Hello, I'm Grace Graciana, a medical nurse with over 9 years of experience. Mostly, this is in emergency care, maternal health, and community outreach. My goal is to raise funds to set up a new medical centre in America. The team designing and building a place where essential care is accessible, where compassion isn't treated like a luxury, and where patients can walk in without fear of being turned away. We aim to become a truly reliable point of help for those who often have none. My background. Born in Pennsylvania, USA, my arrival was a big surprise to my parents who were caught by this great natural event. As we were making our way to our new residence, my birth arrived suddenly and unexpectedly early. Some say this gave impetus to my personal journey into healthcare, which began in 2014 when I enrolled into professional nursing. To begin with, my simplest intention was to help people who never get enough medical help. Stemming from my earliest clinical experiences, I gravitated naturally toward emergency care and maternal health, building my foundations on hands-on care, patient support, and practical problem solving. After completing clinical training, I worked in several community clinics in the USA, also in private facilities where I handled everything from wound care and drug administration to monitoring chronic patients, supporting understaffed units during peak periods. Over the years, I became the go-to person for long shifts, demanding cases, and difficult environments, the kind of work that taught me leadership. US nursing taught me much, but the system, as everyone knows, is often narrowed by lack of people's wealth, and that pull eventually led me to work abroad. This became a defining chapter, not because it was easy, but because it demanded everything I had. Working long stretches with little rest, supporting overstretched teams, managing supplies, delivering preventive care, wound care, whichever tasks needed hands, all under constant pressure to step in where resources were limited. The workload was enormous, the impact demanding. Somewhere in the middle of all that work, and in honor of my late mother, the idea for my own medical centre back home began to take shape. Not a dream of entrepreneurship, but a series of practical observations and measures. Each day, I saw patients who delayed treatment because either they could not afford private hospital fees, or there were simply no reliable clinics close to home. I knew that with the right setup, I could offer basic, essential care, wound management, vitals monitoring, maternal support, basic lab checks, at a cost people in a poor community anywhere could realistically manage. From this experience, my vision was to manifest a functional, community-level centre where people who can't afford private healthcare can still walk in and receive quality treatment with dignity. As I worked this concept through, it was simply not enough for me to be dreaming about this basic social improvement, so I started preparing the centre. Over the past 2 years, I have sourced functional equipment from liquidation markets and NGO off-cycles, finding in many similar places many frontline workers getting supplies when budgets are tight. Working abroad also exposed me to medical equipment that was either unavailable or overpriced back home, these being items that clinics were discarding or replacing, and all in good condition. Acquiring good functional equipment, I have personally secured a portable examination table and beds, basic diagnostic sets, BP monitors, stethoscopes, pulse oximeters, a nebulizer, a compact autoclave, foldable privacy screens, a portable oxygen concentrator, a fully functional ultrasound, sterilization units, an electricity generator. None of these are extravagant, but they are the type of equipment that can keep a small centre functional and play key roles in maintaining health. All the items I have found in order have been carefully inspected, checked, packed and stored with the intention of getting them home and using them as I have described. Shipping, however, has been a huge financial strain and a personal burden. Costs have risen repeatedly this year, stretching my income thin across medical missions. The logistics of securing equipment have slowed progress, stretching remittances and the costs of living. I have now reached the limit of what I can cover alone, and this is one very real request for donations here in GoFundMe. What drives me now is simple. I have seen healthcare inequality up close, and I will not stand by while people back home suffer basic care. I intend to build a centre where low-income patients can walk in without fear of being turned away, a place where essential care is accessible, and where compassion isn't treated like a luxury, one that becomes a reliable point of help for those who often have none. Plans are over 75% complete. I already have the space secured, the equipment sourced, and the blueprint drafted, and a clear plan for setup and early operations. What remains is the final push: shipping the equipment, setting up the facility, and completing the regulatory requirements. I have come far on my own, closer than I have ever been, but I reached the stage where external support will determine how soon I can leave my current post and proceed with manifesting the centre. This is why we are fundraising. With sufficient support, I can launch and offer reliable, affordable medical care to people who need it most. Based on the full plan I've been developing, the centre could be operational within 3 to 5 months. The medical property is already secured, and I've mapped out the renovation phases with a contractor. The building only needs internal restructuring, converting one section into a small reception and triage area, another into 2 consultation rooms, and a space dedicated to maternal and child health. The staffing plan is also clear. At launch, the centre will employ 8 to 12 people, including 3 registered nurses, including myself, 1 midwife, 1 laboratory scientist, 1 pharmacy technician, 1 health records officer, 1 general practitioner on rotating schedule, 1 cleaner and support staff, 2 security personnel, which is essential. This team size allows us to operate a community centre capable of handling basic emergencies, maternal and child care, wound management, routine testing, vaccinations, and chronic illness monitoring. Long-term, once revenue starts to stabilise, the plan is to add a small diagnostic wing. We're now working to ship our equipment currently stored, which now forms the backbone of the clinic setup. Alongside, I've been gradually purchasing medication supply over the past few months. I am facing a struggle bringing these back home, frustrating, not impossible, but recovering these assets means the clinic can begin at a higher standard from day one. Losing these could set the project back years. For donors, the impact is straightforward and measurable. Support doesn't just help us get to safety, it directly contributes to opening a sustainable medical centre designed for communities who have limited access to care. Based on the patient load projections that I've studied with local health workers, once fully operational, we will be able to serve 150 to 400 patients per month. That's meaningful, life-changing care, especially for women and children who often skip treatment because of cost or distance. These aspects of our aims is why I'm fundraising. With support, I can launch and offer reliable, affordable care to people who need it most. This project isn't built on emotions alone. It's built on years of skill, sacrifice, and a plan that is already more than halfway in motion. All I ask for is people willing to help me finish what I've been tirelessly building for years. Thank you for reading this. We would love to read your comments, and we look forward to inviting you to the opening of the centre. Following GoFundMe.com and bowing to their wisdom, we are looking to raise $4,500 on our first campaign, and another $5,000 once that is achieved. Thank you for reading. Please help us and spread the word. Peace and courage. Grace.